And let's bring in Professor of Epidemiology at UCLA, Dr. Anne Rimoin, for more. Hi, Dr. Rimoin. Thanks for coming on. So what does Ebola do to the body?
Well, Ebola is a viral hemorrhagic fever. And so what will start out as likely some kind of non-specific kind of illness will then progress to potentially vomiting and diarrhea. And then some people do end up having some of these hemorrhagic signs. And it's important to note that not everybody has this kind of dramatic the hemorrhaging, the bleeding that we talk about. Of course, that does happen, but sometimes the symptoms are less obvious, and that's why this outbreak. Part of the reason that this outbreak was not noted for an extended period of time, because the symptoms are not always clear. It could be some other disease. And then in addition to that, it was because the diagnostics did not work against this particular species of Ebola virus.
Officials are reporting 513 suspected cases and 131 deaths that could be related to the outbreak. What's your reaction when you hear those numbers?
This is a very serious situation. I've been working in DRC for almost a quarter of a century, and this is the most serious situation that I have seen when it comes to Ebola, all of which are very serious. The problem here is that we're late to the party, that we don't have information on all of the cases. There have been a lot of chains of transmission that have occurred, and I think that we can expect to see certainly expect to see more cases and more deaths as the disease surveillance starts to widen and diagnostics start to be available.
So how does Ebola spread?
Ebola spreads from person to person with bodily contact with somebody who has Ebola, and in general with contact with bodily fluids. That's why healthcare workers are often at great risks. People that go to funerals and are hugging each other and in very close contact. People that live in the same household. So people that are taking care of other people that are sick. So this is why this is a disease that is containable. You just need to have very, very good information out there, getting in touch with cases, being able to quarantine those people that have been exposed, isolate the cases, get them good care in places that can actually handle a case without exposing the healthcare workers. This is very complex.
So how likely do you think this is to spread beyond Central Africa?
I mean, I think that other countries in the region certainly are at risk of having additional cases. We saw this in the West Africa outbreak from 2013 to 2016, where you had several countries affected. I think that the risk to the general population globally is low, but it's very important that we get in front of this because lives are at stake at this particular moment. And it is something that will exhaust resources. It will affect families. It will affect many, many people. And it is a very, very serious virus.
All right, Dr. Anne Rimoin, we appreciate your time today. Thank you.